Coming up, we'll be on location at Aria Wellness Center in Silver Spring, Maryland, discussing natural and effective treatments for opioid addiction and how they can help you regain your life, your health, and wellness with one of this region's top doctors, Dr. Chintu Sharma. Dr. Sharma received his medical degree from the University of Iowa's Carver College of Medicine and completed his residency at LA County USC Medical Center in Los Angeles, California. Dr. Sharma is widely recognized as one of this area's leading doctors. Welcome, Dr. Sharma. It's a pleasure having you on our program.
Thank you for having me. I appreciate you guys reaching out and all that you're doing.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about regarding a very, very important topic. It's an epidemic, in fact, the opioid epidemic. And we're also going to be hearing from some patients a bit later as well. But I wanted to begin by having you tell us about this crisis, the opioid epidemic, and all the horrific damage it's doing to so many people, so many communities. It's not just where some people think it is, right? It's isolated to the rural areas. It's afflicting literally everyone, everywhere in this great country. And I wanted to have you please tell us about just how prevalent it is and how big of a problem it is.
I will start by saying this is a problem that affects us all. There is no one that can say there isn't somebody they know, or even someone they've heard about, or someone even within their immediate family who's affected by this. When we were originally trained, long ago, I'm going to say long ago because it feels like years now, years and years, we were told that all pain should be treated, that pain is the fifth vital sign, and that we have to document and treat it on everyone. At the same time, we were told that the medications that we're prescribing and using are harmless. Oh, a little constipation is what your patients will have, but this will get rid of their pain, and that's what's most important. And the way it was driven and sold, we pursued that really well. In fact, if you tell a group of doctors that this is going to help patients, we will move heaven and earth for them. We will. That's what we do. And we did. Unfortunately, through my experiences, I've learned that it wasn't a good transition to do that. It wasn't the right thing. By focusing on pain so much, it almost enabled this epidemic to explode. We started with just treating grandma with medications that are 10 times or 20 times what she needed, to treating everybody. In fact, I remember my cousin she went to the emergency room for a little earache, for a little ear infection. They gave her Dilaudid. Dilaudid is one of the most powerful medications you can treat pain with. And boy, did she describe that. She described every inch of that as the best experience she's ever had in her life. And someone who's going through depression, the loss of a father, and all these things, experiencing that, can promote addiction.
Yes.
And we do it without even thinking. And countless numbers of lives have been lost for this.
Yes.
Our numbers, instead of going down yearly, have gone up. 2017 and 2016 we're averaging about 55,000 people a year. We're well above 60 now. That's a life every 9 minutes for something that shouldn't be happening.
Absolutely. It's hurting so many folks and families out there, Doctor. And from what you just told us, it sounds like it really goes back, and its origins, as you said, to the
way we were taught.
Addiction that we developed with pain medication, because that's what at that time, many years ago, as you said, was the cure-all, right? Take this medication, the pain will go away, or at least it'll keep it manageable for an individual. And from all that came this ugly thing called this opioid crisis.
Now, this is normal people we're talking about.
Yeah.
We're not just talking about addicts. There are
Yeah.
folks who are addicted and they have trouble.
Yes.
And there are just normal people who shouldn't be even on these medications who now are addicted. This population did not choose this fate. They did not choose this. And it's not that it was forced, but it was something that we found was a treatment. Seeing the stats and just seeing what it does is just, it's groundbreaking. It takes my breath away every time. If someone were to tell you that, hey, you're having sleep apnea, we're going to test you out. And then we collect data again and again and again, and it shows, hey, oh, there's a group of people out there whose central nervous system shuts down. It just turns off. It stops breathing. And then we go back and we look through that data and we're like, oh, a lot of these people are on narcotic medication. They're on benzos. And then we go back and we say, oh, look at all these people dying in their sleep. A little bit of alcohol, a little bit of Percocet, and they're gone. Yeah. Or a lot of alcohol and I'm addicted, and a lot of Percocet and I'm gone. Or think about the disability. There are folks who cannot rehab. There are folks who cannot function. We've created a society where things just don't work. And this was one of the triggers. I'm not going to say it's everything, but it's one. And it's a significant one. Because I don't know anyone, even amongst us doctors, who doesn't have someone in the family or a friend that we know that's suffering from this addiction. And if you take our children, and if you take this whole world, and if you think that you are in a castle protected from this, you're wrong.
Yes. It's hitting everyone, unfortunately, in some shape, form, or the other. Now, who would you say, with your vast experience and your expertise as far as countering the opioid crisis, which you're doing a great job, and we're going to get into that in a couple of minutes, but who would you say out there watching right now would be more susceptible to this horrific
There
problem?
are large populations of people who are on medications they shouldn't be. So if you take everyone over the age of 65 on Percocet, Ativan, Xanax, these are all medications with consequences. And there are a lot of people on it. I'm not going to, speak out against the pharmaceutical industry. They're medications we need. They're medications that are essential. You can't throw out the baby with the bathwater. We need those medications. There are a lot of things we treat, but there are groups that are going to be susceptible to death that shouldn't be. So our elderly are in particular an interesting one. If we treat, let's say, blood pressure aggressively, or we treat pain aggressively or anxiety aggressively in our elderly, you're going to see more hip fractures. You're going to see more complications. These are all things that lead to further morbidity and death. From my personal experience, I've seen a lot of people go through this. A lot more than it makes sense. If I were to just survey all the hip fractures I've seen over the last, let's say, 15 years, and I were just to look at their charts and say how many of them had pain medication or antidepressant or an extra medication they didn't need to, all of them did. So there's definitely a benefit for our elderly and everyone over the age of 65. There's definitely a benefit for folks at the age of 30. So instead of reaching for pain medication, what if we had a biofreeze with CBD oil or cream or something that were just a little more mild, didn't affect the respiratory center, allowed excellent relief and recovery, had effects beyond just the actual oil in that joint. Sometimes the effects are an improved sense of well-being. Sometimes the effects are, I feel like a person again. Sometimes the effects are, I can sleep. Those are things that matter. So I could come up with different medications to treat those issues separately, or I can find a whole plant that does it all.
Yes, and that's where medical cannabis comes in.
Absolutely.
And a very natural alternative that you and so many other doctors like yourself are really helping so many people with combat not just the opioid crisis, but it can help folks with ADHD issues, PTSD, and a whole host of other problems that they're going through, right, Dr. Sharma?
So the answer is yes, yes, and yes. And it kind of boils down to this. So every state has a different set of diagnoses that they find acceptable. But every state also has what I call an extra diagnosis, which is a diagnosis which has been treated with standard therapies and has failed.
Yes.
And I can't tell you how many people fall into all of the above. So yes, PTSD, yes to anorexia, yes to cancer patients, yes to HIV patients, yes to people with just general arthritis, people with back pain, people who feel like they can't move, fibromyalgia, depression, folks who have autism. I mean, I have kids who are coming here with autism, and the preliminary, studies from Israel are amazing. So there are plenty of things we can treat with this, and we can treat it in a manner where I can confidently say that I have not seen anyone die of till to date. It's the one natural therapy we can prescribe, which has zero mortality associated with it. There are very few things that I've prescribed that I can say there's a zero mortality with.
Yes.
And medical cannabis used responsibly and responsible use in recreational states is a way to treat disease.
And that's why it's becoming so widely accepted. That's why we have you on today, in fact, to educate this community on the benefits that so many people are gaining from utilizing medical cannabis, Dr. Sharma. And I wanted to ask you, what's the evaluation process from when someone contacts you or they come to your center here? What takes place?
So we've had to expand and grow with this and actually change things over time. The initial process that the state set forth in Maryland and also in Virginia is the same. The patient will register with the state and get a patient ID number. After you get the patient ID number, you have to be certified by a clinician. After you get certified by a clinician, you actually, at that point in time, can go to the dispensary and purchase medication. The issue is I've run into numerous patients in that age group that could benefit the most who don't have email addresses. And they don't have access to computers in some cases, or in some cases, they just don't have the wherewithal to take the basic things that you need to register with and upload them onto a system. So in order to help with that, we've actually taken extra steps. We've hired folks actually to sit here and register patients. I've done it myself. And I realized that I didn't realize it was that bad of a problem until I started registering people myself. And because of that, I have an extra assistant who will just be here pretty much every day of the week, ready to register folks. They just need to call in.
Yes, make it really convenient for them. For the ones who can't go online, things that we take for granted that are available to a lot of folks aren't also available to other folks.
It's not easy for everyone.
Yes.
Even though I thought it was an easy process to go through,
yes,
there's so many people who just couldn't. And, seeing them and watching them through them and shepherding people to the right answer, that's what we're here for.
Yes, absolutely. And as far as some of the strategies or therapies that are available, because you really customize your treatment plans for each of your patients because everyone's going through different things. Some may overlap in some areas, but they have other issues in other areas. So you really go through the diagnosis, you customize treatment plans. Can you tell us a little bit more about that, Dr. Sharma?
Absolutely. So patients fall into one of two categories. One is just like any other person who hasn't had treatment, it's cannabis naive, or they haven't been treated with it. And there's cannabis not naive, or they've been exposed to it. The folks who know how to use cannabis, I'm here to get them registered and safely using.
Okay.
For the folks who don't know cannabis, don't understand cannabis, I have a whole lecture series I perform in the community at least once or twice a month. Different topics, different places, Mid-County Rec Center, it doesn't matter where, but if people need to hear about it, they need to learn about it too. As a treatment plan, there are different options I offer my patients. There are patients who need extreme privacy in this area.
Yes.
For those patients, I have a special VIP concierge service because their privacy is important. I have a service where I can escort them into a dispensary, into basically a clinic room they provided me with, and I can see them and take care of them. Unfortunately, that means I have to shut down the clinic that day, and it tends to be a little bit costly for folks, but that's available. For other folks that cannot reach the clinic, I'm willing to make house calls or even use telemedicine to visit with them. That way we can not only treat them, but help them in their home environment. There have been folks I've gone to their homes, terminal conditions and such. And, you know, we try to work them in where we can. For your average patient who can make it into our doors, we do have that handicap access ramp nearby.
Okay.
People can come in here pretty easily. And between me and my assistant, we can help people into the rooms. So for folks who make it to the clinic, we have our standard consultation where we go through therapy at that time. Now, therapy can consist of several different options. It's not one size fits all. For those who have extreme pain and need rapid treatment, a rapid onset of effect, usually vaping and smoking cannabis is the best option.
Mm-hmm.
And the reason is there's a 5 to 10 minute onset and effect. So people who have extremely bad conditions and extremely horrible pain can get immediate relief. There's so many different things and options that are available. Smoking is natural, it's quick in onset. 5 to 10 minutes, immediate relief. There's something to be said about that. There's a lot of value.
Yes.
There's transdermal, which is across the skin. So you have oils, you have creams, you have patches,
Okay.
and all of these are viable options. You have biofreeze. I mean, for your athlete that's out there who's had an injury, I have an oil I can prescribe that goes right to the joint. You don't need systemic effects.
No.
You don't need side effects whatsoever.
And they get quick results from what you're saying.
Some people love it.
Yes.
Some people absolutely love it.
In a very safe and natural manner, Dr. Sharma.
It's oil.
The key point
It's
there.
oil.
Yes. Yes. You're absolutely right. Very interesting, the offerings that are available along these natural lines, from medical cannabis to the oils you're talking about, that can help a wide range of folks, literally anyone out there going through different things, right, as you just touched on.
I will preface it with one thing. We have to take an approach which is responsible. So folks who use these medications have to be responsible for being
course.
aware of what too much looks like, and to be responsible when operating machinery and cars and all of these things.
Yes.
In the same lines as that responsibility, the oils, we have to train folks who are cannabis naive on how to use properly.
Yes.
And so folks who don't have experience with cannabis, if I were to tell you, hey, just take the oil, without giving you a little bit of titration instructions, which I put on my Instagram page for everyone, I'm not hiding these things. I want everyone to use it.
Yeah.
With hourly titration, we can treat people in such a way that they can reach a therapeutic dose without having too much. Too much is not pleasant.
In anything, you're right.
Yeah.
Absolutely. And it applies
we're
here.
trying to avoid creating another epidemic. This
That's
is
right.
responsible use we're talking about.
Yes, in a very safe manner, as we've said multiple times here, because that's the key. The different medications, those can be addictive. They can be damaging over time. There is a time, as you said earlier, where we need those, and no one's saying they need to go away, but at the same time, they have to be used responsibly as well. And unfortunately, there are a number of people that become addicted to these medications, and then that's what you've been talking about, the damage that comes from that. And here you've got this alternative that's helping so many folks.
I can elaborate a little bit and give you a little bit about how that works. It's interesting. Pain as a process hits wires in the body, and then we're wired to kind of feel and sense things. It's a safety mechanism. If you shut down someone's pain 100%, you increase their ability to injure themselves because your sensory input decreases. And after a point in time, you've saturated every pain receptor in a person's body. Why is more going to help? So there are a lot of really interesting things we've done with pain. What we realize with cannabis is cannabis hits a lot of the same receptors along an endocannabinoid-based system. The receptors lie within our nervous system and different organs as well as the immune system. And if you channel this medication at the right dose, it's not that its goal is to eliminate pain, but it's going to hit these receptors and help modulate it. It's going to help it make it easier to control.
Yeah.
If you're feeling better because cannabis helped you feel better, your ability to control pain is that much easier. So it's not just about, hey, I took these medications and eliminated this. I took this, I felt better, I slept better, I'm able to function, and I'm going to do some exercise to deal with this joint pain I have.
Yes,
That's a different way to think about pain.
that's right.
And that is essential to help treating people in this opioid crisis and with trouble. The other thing is, as we start cannabis, once we get to the level where it works, people will naturally be able to wean off of these medications, and that's where I can help. So you start cannabis, you get to a point where your pain is starting to feel like it's controllable. Start minimizing your use of your common medications. See what happens within 6 months. A lot of these patients will naturally wean themselves off of these medications. And if they need to be seen weekly for it, they can come in anytime. We can talk on the phone. The main thing is this option is now available. This option is viable. It has a biochemical pathway it uses.
Yes.
And our body was born with a natural cannabis system. It's not that we're forcing this into receptors that weren't there. Somehow nature did it for us. We have a system of receptors that sit in our body that hit 2 natural endogenous protein-based hormones, 2-AG and dynamide, which naturally exist, which we have this natural mimic in cannabis.
Mm.
How beautiful is that?
Yes. Very
and why can't we harness that? We should be harnessing
Absolutely.
that. Why is it illegal? Why is there so much trouble just obtaining a natural therapy that hits something that your body naturally has?
Yes. Well, it's great to know that at least we have come to this point as a society, right?
It's
Where
amazing.
at least now it is available for medicinal purposes, and folks like you are able to be there to help so many people, because for up until recently it was not legal. But now it has become legal in many areas and regions, and we need it to be available to everyone, doctor, because it has so many natural benefits, as you've been telling us about.
And one of the more important things to mention is that there's a lot of stigma associated with this, and it's just unbelievable how people perceive cannabis.
Yeah.
It's a medication.
Yeah.
This is what we want to use it for. Yes, it can be used recreationally, but as long as it's used responsibly, nobody gets hurt.
That's right.
And why can't we use something that we were built to have in our system
Yes.
that can naturally harness what we have? Nature made this.
Yes.
When they made us, and we made us with the system.
That's right.
Not just to let it go.
And that's what we're talking about. You're talking about in a responsible manner. Medical cannabis is really a great alternative to help so many people as it already is now. We're now going to hear from some patients of Dr. Sharma and Arya Wellness Center. Welcome, Rodney. It's a pleasure having you on our program today.
Pleasure to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Rodney, by having you please tell us what you were going through and experiencing that was affecting your life prior to coming to Dr. Sharma.
So prior to coming to Dr. Sharma, I spent 21 years in the Army Reserve, a couple of deployments to Iraq. So I am a disabled veteran, and I was experiencing just some PTSD, some trouble sleeping, issues sleeping, then just a lot of medical issues as a result of my time frame being with the military for quite some time.
Oh, so you're going through all that after having spent a long time with serving and protecting all of us in the military. And thank you, by the way, for that, on that note,
Thank you very
for
much.
doing that. But you were experiencing a lot of issues, the PTSD, the symptoms and issues and others that you just touched
Yes.
on. And how long were you experiencing all that for? Did it just kind of ease in after you left the military and then just get worse and worse over time, or what happened?
Well, I knew I had it. However, the pride caused me not to recognize it. And over the years, I've got to know Dr. Sharma. And just over the past years of just talking with Dr. Sharma and developing a relationship with him, he made me realize, okay, there might be some other alternatives out there for you that can assist you.
So speaking of those other alternatives that can help you, what happened? You came, you met him,
Yes.
and then what took place after that?
I came, I met him, we did a whole diagnosis. Prior to that, I also did go to the Veterans Affairs and go through the process with the Veterans Affairs to see the psychologist, psychiatrist, things of that stuff. But they wanted to put me on some very heavy dose medications,
Oh
which
boy.
I didn't see the benefits of that.
Absolutely.
Having many years in the pharmaceutical industry, that wasn't a major benefit of mine.
Sure.
So I wanted to look at something that was a little bit more of a natural base.
And then what did Dr. Sharma recommend?
Well, Dr. Sharma recommended there's some alternatives out there as far as the medical cannabis side of the house that can probably benefit me.
Wonderful. So then that's what was, after you went through your initial diagnosis with him, He then tailored a medical cannabis
Yes.
alternative program.
Yes.
Because going to the psychiatrists and the other doctors that you had previously gone to through the VA really wasn't working
Really
for
was
you.
not working for me.
The issues were still there.
The issues were still there. Increased side effects along with some of the medication that's associated with it. The long-term effects. When someone tells you, well, here's a medication, you have to start at this very, very, very low dose, and we'll slowly stage you up to this higher dose. And oh, by the way, once you get to this dose, you can't go off unless you come see us and we tell you back down. That's a red flag.
Absolutely, and happens too often,
Too often.
unfortunately.
Too often.
So then what took place?
So first I went through after developing a relationship and working with Dr. Sharma, was advised I have to go through the process through the state to initially get my application through the state of Maryland. And then once I get the application, then I can finalize and see Dr. Sharma to get the actual prescriptions and things that I need. So that I can now go to a dispensary with the prescription and get what I need.
Yes, indeed. And that happened.
That happened.
And how are you today?
You know what? Everyone sees a difference. From everyone that has known me for years asks, okay, there's a difference in you. So I'm not having issues sleeping. I don't have any issues where I'm sleeping and I'm reminiscing on movements we did while we were in Iraq or things that took place in Iraq. So my quality of life has been better for me.
Oh, we are so happy to hear that, Rodney. And obviously your significant others and loved ones are
happy
beneficiaries
also.
of that,
Beneficiaries,
of improved quality
Yes.
of life for you. And before we let you go, is there anything else you'd like to share with our viewers, Rodney?
I highly recommend looking at the alternatives that are available to you right now. It's growing massively. The legal cannabis area, the medical legal aspect of it is growing amazingly. And I definitely see the benefits for me personally from when I was on medication, being off the medication, and being more on the medical cannabis side of things.
Yes.
Even in the morning, I'm much calmer. So even when the kids are behind and late, it used to be I would be rushing them, so their day would start off wrong. I'm much calmer. I just able to understand and deal with what they're going with, and just get through the day in a positive way.
In a natural way as
natural
well,
way,
like you
yes.
said, because there's really a lot. That's one of the reasons we're here today, hearing from you and others, and as well as Dr. Sharma, and that is that one of the worst things we can do to ourselves is become addicted to medication.
Right.
And over, like you gave that great example a couple of minutes ago, it starts with a smaller dose, works its way up, and at that point you basically have to stay on it.
Stay on it.
And even then it not only is it hurting you physically,
Right.
but it's also really not helping you with the issue.
At all.
And by coming then to Dr. Sharma, and having the diagnosis done, and then the treatment plan that you've been on with the medical cannabis,
Yes.
obviously you're a very happy man
Yes.
now, and in a natural,
In a
safe
natural
manner.
sense, safe manner. I spent years working for a large pharmaceutical company that and trained the sales force and wrote the training manuals for medications for schizophrenia. I won't name the medication, but it's a very well-known one. And so I understand and know the side effects of the medications that's there. And so I also am aware, know a couple of other physicians who have left practices from being an OBGYN to just be more involved with the natural sense of the medicine, because they want to see something more natural.
Yes, absolutely. On that note, we'd like to thank you, Rodney, for sharing some of your experiences and being a guest on our program.
Yes.
It was a pleasure having you on.
Thank you for having me.
Thank you.
Thank you.
Welcome, Joey. It's great having you on today with us as well.
Thank you for having me.
It's our pleasure. I wanted to ask you, Joey, if you can please tell us what you are experiencing as far as any issues, problems that really brought you to Dr. Sharma.
Well, I've been living with ADHD my whole life, and most recently was diagnosed with PTSD from domestic violence. It changes you. There's a lot of things you don't realize that manifest physically from the mental trauma, but a lot of muscle spasms, let alone the depressions, the increased anxiety that you really feel physically. It's a lot. But after going from the traditional pills, of which doctors had me on 7 different pills, a lot of which didn't even counteract well with each other, but they were still prescribed from the same medical doctor. I was able to wean off of them and now am 100% natural. So I utilize cannabis not just by inhaling it, but I also utilize it as a topical cream. I get frequent muscle spasms. Not sure where they come from, but it's one of those symptoms. And typically they'll hurt real bad. I mean, it feels like you were in the gym for 3 days straight just giving it your all, and your muscles will shake. There's a CBD cream that now I can utilize that calms the muscle spasms down and makes it so there's not so much pain after they're done fluttering. So everything's changed. I don't feel like a zombie anymore. I was actually having moments of blackouts that I thought were due to the PTSD, but after getting off of the pills, those have stopped. So I'm no expert, but I would have to attribute those blackouts now to the pills, and the cannabis has taken all that away.
We're so happy to hear, Joey, where you are today compared to what you were going through before coming to Dr. Sharma with you said 7 different pill subscriptions were given to you that you were on. Obviously the issues that result from those, as Rodney or the previous patient we just heard from and many others watching today can relate to. So you came here, you're off the pills, you're taking the natural way to get better, right? Through the medical cannabis. And I'm so happy to hear that your symptoms overall, as you just said, that you were going through prior to coming to Dr. Sharma are basically gone.
Basically gone. I mean, they still rear their ugly heads, but they're a lot shorter, a lot easier to get through.
Yes.
And I can still function throughout the day, unlike the side effects or the crash from a lot of these pills. It's a whole new lifestyle.
So you got your quality of life back, Joey.
Yeah, once again, I'd say, and now that we know everything that we know about cannabis, looking back, I can see why in my early 20s, say, I used it what I thought was recreationally, but it actually helped for my ADHD as well. So this only isn't treating my PTSD symptoms, it's also helping to treat my ADHD. Now that I have access to availability of all these different strains, I can pick what works best for my focus versus the nights that I have insomnia and I need something to put me to sleep. So I'm getting multiple benefits from one plant. Unfortunately, while I was on the pills, my GI tract took a hit. It did a lot of bad things to my belly. And cannabis is even helping to combat that. And not just cannabis, but hemp protein. I find that hemp protein powder, and this stuff you can buy just at Walmart, is amazing for the GI tract. So it's not a cure-all. A lot of other diet decisions, exercise decisions had to be made. Acupuncture and massage are monumental for my symptoms. But all of that became open to me after learning about cannabis more deeply than I knew on the surface.
Yes.
Getting the guidance from Dr. Sharma and the resources to all these new areas of natural wellness.
Yes. And before we let you go as well, Joey, is there anything else you'd like to say?
No, I urge everybody to educate themselves. So little information's out there. I don't know if anybody's familiar with NORML, the National Organization for the Reform of Marijuana Laws. I work directly with them and have been for 2 years now. That all started with a need to educate myself. And they're a great resource to educate, not just yourself, but your community with chapters nationwide. So I would definitely recommend everybody looking into that for further education. And tell everybody to come out of the canna closet. If the less we hide and the less we feel shamed about this, because it's false shame, the more we can empower other people, not just to explore it, but to be comfortable with their decisions.
Yes, indeed. And on that note, we'd like to thank you, Joey, for joining us and being a guest on our program. It was great having you on.
Again, thanks for having me.
Thank
Likewise.
you. We're now back with Dr. Sharma. I must say, both Rodney and Joey, very happy with the results. Their quality of lives have come back to them, Dr. Sharma. And it's great to hear from our research and other folks that you've helped as well. The results seem to be very powerful, very positive, and all for the better. Some great work.
Thank you. And we hope to help plenty more. We are making ourselves as available as possible. Even on the weeks where the clinic may be closed, I'm available via email, telemedicine, and through many avenues just to get people certified and on the right track. This is a viable option, and it has to be available for all patients. The fact that it isn't it's ethically wrong. I took an oath to help people, and I took an oath to make it affordable. I took an oath to make people improve their lives. That I take seriously. The University of Iowa taught me a lot, but the one thing that it really got me focused on is the right ethical and moral approach to things.
That's right.
And so it's been a struggle watching this epidemic. It's been a struggle watching people go through this. But we're going to help, and we're going to be there.
And you are, and others like you, other doctors also around the country are doing the same as you are, doing a great job of it here in this region. You're helping the community. You even are have an option that you have made available within your services for the military folks as well. Can you just touch on that before we let you go?
So this month we did a lot of community outreach, and we had actually a community session that some people have seen on Instagram and Facebook about PTSD. PTSD is a horrible disorder. And because our military and our first responders are sometimes exposed to things that just leave a lot of scarring behind, and hyperarousal states and trouble sleeping, all sorts of things that just make life difficult, we felt it was important to make ourselves even more available to these patients. So along with some of the people we've advocated with, like Eric Stamper on Initiative 22, he's a guy who fights for veterans' rights to use and veterans' rights to have access. We've dropped our prices to help vets come in here for almost, at cost almost. So for folks who have PTSD who've served, we want to allow them to come see us for the lowest cost possible, $125 a visit. That's, with all the costs and all the stuff that goes into healthcare, that's pretty much going to give that away. And we're okay swallowing that cost because it's more valuable to treat those who've served this country and served us as people, and to treat them as people and citizens.
Yes.
And to treat them as someone who deserves to be normal, or to have that sense. It's important. And we will dedicate ourselves to these things every step of the way. So yes, we've made an effort to reach out to folks with PTSD, especially our vets. And we'll continue to make efforts for small groups that need it. Yes. And yes, some people will pay a full fee. Please understand, you're helping fund our ability to give it away to people who need it too. So we'll keep fighting that fight.
You're fighting the good fight, and a major fight with some great results for helping so many people in this region and other areas as well, in Pennsylvania, Virginia, right, Dr. Sharma? That
Yes.
You yourself are out there helping folks, not just here in Maryland.
Yep.
And on that note, we'd like to thank you for joining us, educating us on this very important topic, and being a guest on our program. It was a pleasure having you on.
Thank you, sir. I appreciate having you
A
come by.
pleasure, and we'd love to have you back on in the future, in fact.
Absolutely.
Thank you.